The medical science has made a lot of progress over the last 30 years, and we hear about new techniques and medicines all the time. Now, surgeons at the Houston Methodist Hospital in the US are using a pioneering imaging technology called Plato's Cave to examine patients virtually.
Things become big and things become
Using 3, 4 and even 5-dimensional imaging allows surgeons to fly through images of their patients, giving them more confidence and reducing risks of errors. This is a visual platform that uses video game graphics and other innovations. Here, doctors, surgeons and medical residents are flicking through blood vessels and examining images precisely and from so many dimensions. By doing this, they know exactly what they're going to encounter in the operating room before scrubbing in. The name Plato's Cave comes from a parable in the Republic written by the Greek philosopher Plato, in which prisoners see only shadows on a wall of a cave and believe them to be reality. The cave allows doctors to view reality differently and test the limits of their imagination. The powerful processing system allows doctors to rapidly feed different types of images such as CT or PET scans, so they can manipulate the data to better explain to a patient what awaits them in the operating room and to troubleshoot potential problems in advance. Dr. Brian Butler, radiation oncologist, developed the cave system and says it gives surgeons a better ability to fight disease and prevent surgical error.
And it also became apparent that we weren't using all the possible data on a patient before we made a decision about a patient. So think of yourself as a stockbroker. You're going to make a decision based on only 10% of the data. Well, now you could accumulate 90% of the data and have a much clearer and a much more focused picture.
Endoscopic skull-based surgeon Dr. Mas Takashima believes the system addresses the core concern surgeons have about operations.
So the key to good surgical success is visualization. And when you have the data so that you can then visualize exactly what's going on, it definitely decreases the stress level or the anxiety level of just wondering, oh, is there a possibility that that blood vessel might be, wrapped around this tumor? And being able to visualize that prior to actually operating on the patient, it definitely cuts down on that because, one, you're more prepared. The more prepared you are, the better surgical outcomes one gets.
Now, doctors see the cave as just the beginning of new advances. This will aid doctors to pinpoint potential problems.